welcome to Medically Speaking, and I am Meenakshi Upreti. With me, a very special guest. I'd like to welcome Dr. Monica Tandon. She's a Senior VP and Head Clinical Development, Glenmark Pharmaceuticals. Thank you, ma'am, first of all, for joining us on NewsX. My very first question to you, there is a lot of curiosity, excitement around India's first nasal spray for COVID patients, something which has been launched by Glenmark. Tell us a little more about Fabi spray. Everyone's talking about it. Help us understand, first of all, for the layman, for those watching the show, what exactly is Fabi spray?
So thank you for the invitation. So Fabi spray is a nasal spray. As you rightly said, it's a very unique novel product. It's been approved for the treatment of mild COVID-19 in patients who have risk of progression of the disease. It's a very easy to use, highly effective spray. It has proven safety and efficacy in global trials, as well as the India recently completed. We've just done a study in 306 patients, Indian COVID-19 patients, where it has proven virological effectiveness and clinical effectiveness. And most remarkable aspect is that it's a very, very safe product, very easy to use, 2 sprays in each nostril 6 times a day. And it's to be used for 1 week for an individual to be cured of COVID-19.
Right. And help us understand, ma'am, what do we know about the efficacy of Fabi spray? What do your trials, the clinical trials which you have conducted, what do they tell you?
Right. I think that's a very important question. So there were trials that were done outside of India, but for regulatory approval, we've conducted a proper randomized double-blind placebo-controlled study, which is a gold standard for clinical trials. Mm-hmm. And in that, we've seen efficacy. We've seen virological effectiveness. So the viral load was reduced very significantly. 99% of the COVID-19 virus was inhibited in just 48 hours. And patients started recovering as early as 4 days. So median time of RT-PCR negativity was 4 days. The WHO scale, which is a highly validated clinical scale for improvement, that was statistically significant in the active arm, which is the Fabi spray arm. And patients were tolerating it very well. It's operational ease of use, so there were no moderate severe events or serious adverse events that were seen in the study. On the whole, clinical, virological safety, efficacy was proven in the trial, and this was replicated. The results were very similar to the UK study that has been published. So the efficacy has been proven, and we received approval yesterday, and it's been launched. And we hope to see that it's there in the markets right from tomorrow, and people are able to use it. It's come at an appropriate time. The pandemic is still raging, and it's going to be of tremendous benefit at this crucial phase of the pandemic.
Right. And what do we know, ma'am, about, help us understand a little bit about the costing of the product. You said you'd like to hit the market in the shelves from tomorrow itself. So would it be safe to assume that if someone wants to get your spray tomorrow, pan-India, that it will be available at pharmaceutical, these local chemist shops on the shelves from tomorrow itself?
Yeah, I think there is a plan to start putting it in the markets from this week, and gradually, in a graded manner, it will be seen in the length and breadth of the country very shortly. Yes.
All right. So,
and regarding the treatment cost, so it's very affordable. The entire treatment for one patient is under 1,000. It's about 850 rupees for treatment of one patient for the full course.
Okay, so and how many bottles would that require when you say 850 to 1,000 rupees for the full course? Are you suggesting the number of product which one will consume and the time limit? Could you elaborate on that also, Val?
So it's just one bottle. 850 rupees is the total cost of treatment for an individual patient. 7-day treatment, 6 times a day in each nostril. It's to be applied as a nasal spray.
And really help us understand, ma'am, how does it work? You say that it can actually kill the virus in a person's body. It can stop it from incubating and spreading further. Help us understand how it really works, so that those who are perhaps suffering as of now, we speak from those who've tested COVID positive and perhaps are interested, in taking Fabi spray, they know a little more about it.
Right, it's a potent antimicrobial, it's a potent antiviral agent. It's been designed to kill the SARS-CoV-2 virus, and studies have demonstrated that. So studies were done in Utah University of USA, where it's inhibited 99% of the SARS-CoV-2 virus, and it has direct antiviral action. So it inhibits the RNA replication. It also nitrosylates the surface proteins. It prevents it from fusion. So it has a multimodal, very effective antiviral effect. And it's across all variants. So it's been studied in epsilon, alpha, beta, and including the delta strain. It's been very, very highly effective in studies that have been conducted.
Right. And right now, the predominant strain in India, even though, of course, we don't have enough genetic testing labs available, it would be safe to assume to say that the predominant strain and the large number of cases which are reported these days or have been in the past month or 2 months have been of Omicron. What do we know about its efficacy against Omicron, ma'am?
So yeah, I think it's very important for us to understand, because we did the trial. We started the trial in July, August timeframe and finished it very recently. So we've kind of been there, included patients in the transitional phase, both when Delta as well as Omicron was there. And so the efficacy, we haven't done genomic testing, but the efficacy stands for both the strains, because both strains were probably included in our trial, and the efficacy was remarkable.
All right. And ma'am, just a question or two more before I let you go. You said right at the onset of this interview that Favi spray is basically for mild COVID cases. Now, could you help us understand, if someone tests COVID positive, would they first of all need a doctor's prescription to get Favi spray? If at all they do get a doctor's prescription, what do you say? What do your studies suggest? Is it to be administered right when a person turns positive in the beginning, or should one wait a little longer? Help us understand. Just give us more clarity on that front, ma'am.
So yes, it's a prescription product. It requires a doctor's prescription. So mild patients at the onset of symptoms, it's to be obviously on a prescription by a medical physician. It's to be considered for administration. And I think symptomatology is important to start the drug. And mild patients or patients who have risk of progression, so they could be unvaccinated, they could be of middle or older ages, they could have comorbidities. There's a significant set of patients, who are mild but still have all these comorbid conditions that will require treatment. But yes, it's a prescription product.
All right, mild, comorbid, and perhaps unvaccinated. My last question then, ma'am, this product, Favi spray, is it only for adults? Can those below 18, can it be administered to them also? Because vaccination is opened up for teenagers 15 plus. And also when you say that it's for the comorbid, for those who haven't gotten vaccinated, am I to assume that those who have been vaccinated perhaps and are not comorbid can skip Favi spray? They may not require Favi spray at all?
So apart from these two populations, even patients who are of middle and older ages, they have a higher risk of developing moderate to severe disease. So unvaccinated, comorbids, middle, older ages, all of them will be indicated for getting Favi spray. And regarding children, yes, outside of India, it's an approved product above 12 years of age. But in India, because we've done trials only in adult patients, so it's indicated in adults.
You say outside of India, ma'am, and that was going to be my last question, just out of curiosity. In how many countries is your product available? In how many countries has it been approved? Tell us a little more about that as you sign off, ma'am.
Right. So it's approved in many countries outside. It's being marketed in Israel, in Bahrain, in Thailand, in Singapore. It's also approved in Europe, Nepal. So there are many countries where it's currently being commercialized.
All right. It's a little early to say, but we really do hope that this nasal spray proves to be a great game changer, really, as far as COVID is concerned. Numbers are on the low. And of course, as we have more products to fight COVID coming out in the market, it does boost the morale and confidence of the common man as well. For now, thank you, ma'am, for joining us on the broadcast and shedding light on this game changer, really, of India's first nasal spray against coronavirus. Thank you for joining us.
Thank you. Thank you very much.
For more such videos, subscribe to the NewsX YouTube channel, hit the bell icon.